Open your ears and listen. Direction for your ambitions. New narrative. This the community coalition. Drumel, Corey, and Dory here for the intervention. We've been letting it slide for too long. Here on not no more slipping. Unity in our communities is how we rise up. Empowerment to self. Knowledge as well. Let's wise up. No more fighting as individuals. We municipal. Change the forecast. This the podcast to listen to. You got a vision. We got a vision. Let's make it visible. Say we gotta fight for our rights. Well then enlist me. All bite, no bark. Real talk. 360.
Hello. How you doing?
We're doing good. How are you?
Hold on. I wasn't talking to you yet. Hold on. We back again. It's Real Talk 360. And it's kind of different now, but it's still good because we're going to talk about my hometown again, Darlington, South Carolina. And you from Darlington County, right? Or you live in Darlington County? I'm from Darlington. Tell the people what your name is and the things you do, but you got to pull that mic towards you. Oh, she done broke it.
My name is Courtney Sheppard. I am a nurse. I'm from Darlington. I work for a local hospital. We do community outreach. And we also help patients with resources that they need.
Okay, what type of resources?
Helping patients find medical doctors. Helping patients find medical doctors, helping them with medications that's affordable, finding resources such as helping with Medicaid applications, disability applications. Bianca, you can chime in.
Yeah, we help find them a primary care physician, get them to and from their appointments if need be, assist them to their appointments, make home visits, just stuff that they need to keep them out the ER, basically.
So there's a lot of that going on.
It is a lot.
In Darlington.
It is a lot.
And a lot of information that I know a lot of people don't know.
It is. Darlington County, in particular, we're talking Lamar, Society Hill, Hartsville, all of Darlington County. When it comes to readmissions in the hospital, the highest is diabetes, hypertension, and congestive heart failure, which if we're able to manage the disease process, that would keep them out of the hospital, such as going to your medical doctor, taking your medications, checking your blood pressures, checking your glucose levels, dieting, exercising, stuff like that. So we want to manage the condition versus treat the condition.
So where your office at?
We are located at McLeod in Family Medicine.
In Darlington or in Florence?
In Florence.
Okay. Because do they still have McLeod in Darlington?
No.
All right, so they shut that down.
But they do still have the doctor's offices in Darlington as well.
Okay, where is that in Darlington? Because I don't see too many doctor's offices in Darlington.
So our providers, and we're based on helping patients who are uninsured or underinsured. So Care South, okay, that's a big one.
Yeah.
And Darlington Free Medical Clinic and Genesis. So those are the three major ones in Darlington that assist patients. If they want to travel to Florence, they can go to Hope Health, McLeod Family Medicine, or Mercy Medicine. Those about, yeah.
So Genesis is the new one that they put on the corner in the square.
Mm-hmm. It is.
Okay. So you say uninsured. I know you say uninsured because a lot of people think that they have insurance. So I mean, they can go get a heart surgery and it's going to be that $100 copay. So tell them the meaning of uninsured.
So uninsured is patients or people in the community that don't have insurance. So with Care South, Genesis, Hope Health, the Free Medical Clinic of Darlington, Mercy Medicine, they can go to the doctor's office and they provide like the sliding scale applications. And some of them pay little as like $10 or $5. And then they have programs that also assist them with their medications where they can get some of their medications for free or they can get their medications for like $5. But you have to qualify.
Do you offhand, do you know the qualifications?
So with
Well Vista, It's no insurance. As long as
No
you have no
insurance.
insurance, you can qualify for your
Yeah.
medication and a primary care physician.
And it meets the qualification same as the food stamp.
Yes.
Food stamp. So technically, let's just say roughly. Matter of fact, I can look it up.
You got to talk while you look it up.
Go ahead and tell them about what I mean. You know, some of the other resources.
Well, yeah, some of the resources we also have, like we find you a primary care physician, get you to and from your appointments if need. We do help patients who do have insurance. So sometimes we have patients who have insurance but need help navigating through the healthcare community. So those patients, will help them like advocate. We'll go with them to their appointments and say, hey, at your house, you said this medication wasn't working right. So let the doctor know that you said this so we can fix it and see what you need to do better. We also take food boxes to patients that need food. We just do everything basically to keep them out in the community, keep them out the ER, keep them in the community, keep them at their doctor's offices versus coming in the hospital.
Okay, I got one more question. So you find them a physician, right?
Yes.
So what if they need like a home aid? Do y'all do that too? Do you find them a home aid?
No, the doctor will find them a home aid, but
Okay.
we kind of assist with that. We assist with everything they need.
But we can like refer. Well, we'll let them pick out who they want,
Mhm.
but we can refer. Like we'll pull up the application.
And
And I-
show them hearts and hands. And,
Yeah.
Hearts and
and
hands.
all that.
Yeah.
So that's a good thing because right beside me is a young lady that owns a home health care. What's your name?
Hi, my name is Cameron Brand, and I do own Hearts and Hands LLC. And it is an in-home program which provide nurses aids to patients.
Say that one more time because the mic was out. Tell them what you do at Hearts and Hands.
At Hearts and Hands, we do provide services by PCAs, patient care aides, to citizens in the community that need services such as helping prepare meals, assistant with grooming, running errands, changing, turning, repositioning, providing a safe environment while in their homes.
How long you been doing that?
Roughly about a year.
A year? How
Yes.
you like it?
I love it. I
You
love
love it?
patient care.
So what's the best part about it?
Taking care of the patients.
What do you offer that they don't offer to make them come over to Hearts and Hands?
We offer our hearts
All right now.
Inside what?
in our hands.
Okay. I will drop one fast. So back to so y'all putting on an event, a wellness event.
Health and awareness event. So I would have nurses there that would be doing finger stick blood sugars, checking blood sugars, doing blood pressure checks. Also, my goal is to give out blood pressure machines, scales, glucose monitors, pulse oximetries, medication organization pills.
What's
and-
that? Well, you got over me on that. What's that?
So
Explain
it's like,
that.
well, it's a pill planner. The
Okay.
Sunday, Monday, Tuesday, Wednesday, Thursday.
Oh yeah, I
Friday.
seen that before. I used to have one of those.
Did you utilize it?
Yeah, I did.
Those come in very handy. It reminds you to take your medicine.
Yeah. So y'all gonna be outside or is it inside? Because you said Virgil Stadium.
Well, it's gonna be outside. That's the goal. But if it rains, then we'll have it in the stadium.
All right.
Not the stadium.
In
I'm
the
sorry,
gym? Okay. So y'all going deep in the neighborhood. That's good, man. That's good. That's where you need it at too.
That's where it's most needed at.
All right. So also you offering sponsorship packages too. Can you explain that?
So I am. I was trying. Well, I want people to donate the blood pressure machines. You know, even if you can donate one, the scale, the pulse oximetries, the pill organizers, the pill planners. If you can donate, you know, for the patients or whatever, we're going to be giving out door prizes as well to the attendees. My goal is to give out an air fryer, a blender, and a juicer.
Okay. So all healthy stuff.
All healthy stuff.
Okay. And so can you tell us something else about it? Because I've never been to one before. I know a lot of people probably never been. So make them say something that make them come.
I mean, health and wellness, that's important.
Yeah,
I mean,
it's important.
I think health and wellness is important. A lot, and plus people in Darlington County, the reason why I did this was because a lot of people in Darlington County, you know, they wait till the last minute to get help. And it's, oh, I had a heart attack, or, oh, I done had a stroke, or, oh, I'm on dialysis. But there are ways and things to do to prevent that, and providing these resources as far as getting them set up with a family doctor, providing them with affordable medications and the resources that they need. Like I go to the hospital all the time, or I go sign a patient up at home, and I didn't know the resources was there. So we want to prevent this from happening, because now we're seeing it with people that are in their 20s that's on dialysis.
Yeah, I seen that too.
Mm-hmm.
They get younger and younger.
Younger and younger.
Actually, I was with a guy today that one day he woke up, he wasn't feeling too well. So he went to the hospital, and the doctor asked him, "How did you get here?" He said, "In my car." He said, "I don't see how you got here, because you got 3 clogged."
Arteries.
I forgot what he said, but whatever it was, 3 of them, it was clogged. So he had to stay in the hospital. He said, "I don't even know how you made it here. You should have been dead." So he had to have a triple bypass.
Mm-hmm.
And I just met him today, and he told me about that. And he said, I didn't know.
Mm-hmm. That's how it happens. Or I haven't taken my blood pressure medicine in 2 years because I just couldn't afford it. You know, with COVID, it impacted a lot of people in their jobs and stuff.
Yeah.
So a lot of them, they don't have medical insurance. They don't have, the medications and stuff they need.
Yeah, I see that all the time.
All the time.
I saw a lady said her good RX card didn't work last week. So she had to spend $35 on 2 pills and still had a bill to pay.
Yep, that's about right. Because you think about it, like you were saying, the guy with the clogged arteries, he's going to probably be on Eliquis. Eliquis costs like $500 or $600 without insurance. So who got $500 or $600 to pay for this medicine that they need in order to survive?
Yeah. And Medicaid ain't gonna pay that, is it?
Not if Medicaid to pay for it, but I'm
Oh,
just saying, if the patients that don't have insurance and don't qualify for Medicaid or disability.
Oh, okay.
Right.
Well,
So
go ahead, my fault.
So agreeing with Courtney, prevention is always key. Once you do develop the disease, then we do want to manage the disease, but trying to catch it and prevent the disease is the ultimate goal. So having this health fair and this health awareness will identify community members who may have blood pressure or on the borderline of diabetes, and can then follow up with a physician that these ladies may assign them to or get them in contact with. So we do want to prevent the disease.
Oh, that's good. That's good.
And I have a list of people that will be attending. They're steady coming in. So far we have the Free Medical Clinic of Darlington.
Okay. Let's drop a bomb, because I like the free clinic. Help the people out.
The Free Medical Clinic of Darlington. We will have Care South will be there as well.
Okay.
Hope Health Prevention and Specialists, they'll be there. Access Health, Healthy Outcomes with McLeod will be there. L&M Holistic Healthcare Services, she'll be there as well. A Better You Coach and Counseling, because I didn't bring up mental health, but mental health is also another important one as well.
Yeah.
And we'll have Hearts and Hands Home Care Services and Lives Transportation.
Oh, let's drop 2 bombs for that. Thank you.
And New Life Fit also. So they're still coming in. So I'm looking for a lot of organizations to participate. So it's coming in.
That's good.
And if anyone out there, is interested, please contact me.
How do they contact you?
They can contact me at COURTNEY SHEPPARD 1321@yahoo.com. That's the best email.
Say it one more time in the mic so the whole world can hear.
COURTNEY SHEPPARD 1321@yahoo.com.
Okay.
Yeah, I constantly check my emails.
All right. And so just looking at this, so you're gonna try to give away weight scales, blood pressure cuffs, glucose monitors, the medication organization pills, and pulse
Oximetries,
what's that?
where you check your pulse.
Oh, I had one of those too.
You had it all.
Yeah, at one time I gave it all back to them. So Is there anything else you want to say? Because she didn't say nothing.
I did say stuff.
What you say?
I talked about
Y'all work together?
we work together. We talk about the resources in the community, and our goal is to keep our patients out the ER, out the hospital, and in their doctor's office.
Okay.
Yeah.
So
Oh.
this goal, my goal for Darlington community is to try to get the numbers down because, you know, we went on the government Center for Medicare and Medicaid Services, and the rate was 62% for Darlington County for hypertension. So that's kind of high, 62%. And then diabetes was the next one at 20.8%, and heart disease is 30%. So those were the three highest, and that was in 2012, 2021.
I'll say, what was diabetes again?
20.8.
And what was hypertension? Did I say that right?
62%.
So that means a lot of people in Darlington got high blood pressure.
That means we need to cut back on that salt, start dieting, exercising, cut back on that processed meat.
And it's all on the side of the street on Saturdays when you come down Main Street too.
You're right.
It's all on the check. So y'all got a job. Y'all got a job to do. And this congrats. That's a big job to take on. And you look like you're sincere about it. And don't look like you're just trying to get some money. That's a good thing.
No, because the event is free. Free for vendors, free for everybody that's coming in. It's free. You don't have to pay for anything. Just show up.
Please show up.
Please.
All right. And you want to tell these people how they can get in touch with Hearts and Hands?
Sure. You can get in touch with Hearts and Hands, Hearts and Hands AA at gmail.com. That's the email address. Or you can visit our office, 1951 Pisgah Road, Suite 105. Or you can give us a call, 843-413-3286.
Okay. Well, ladies, I enjoyed having when y'all come. And come back after and tell us how it went. And we'll always support you. Just let us know, and you can always come on here.
Thank you. We appreciate you having us.
No problem. Y'all have a good day.
You too. Thank you.
Open your ears and listen. Direct